Have you ever stopped to think, what happens if you, at age 60 or above, suddenly face a stroke and you are alone? It shocked me as a health practitioner to learn how many seniors underestimate this risk. Here's the hidden truth. Strokes in people over 60 are not just about the event itself. It's about what happens afterward, especially when help is delayed or absent. Consider the stats. According to the Centers for Disease Control and Prevention, CDC, stroke is a leading cause of serious long-term disability in adults, and risk increases with age. For those over 65, the death rate from stroke was 242.7 per 100,000 persons in 2018, and for those 85 and over, it was 984.3 per 100,000 persons. If you are over 60, you owe it to yourself to be prepared, not just for prevention, but for survival. Over the next minutes, I'll walk you through 7 life-saving tips every senior must know. I'll share real cases, show you the hidden danger behind what seems safe, and give you safer alternatives. You won't believe tip number 2. Please comment below if you or a friend are over 60 and living alone. How prepared do you feel for a stroke emergency? Tip 1. Know and act on the warning signs immediately. Why it seems safe? Many seniors assume they'll recognize a stroke easily. After all, numbness, face droop, speech trouble are common warnings. Hidden danger. What often happens is delay. Seniors living alone may dismiss early symptoms, for example, mild dizziness, or wait, thinking it might pass. Yet time counts. The sooner you act, the better your odds. One study found that arrival at hospital within 3 hours of first symptoms often leads to less disability at 3 months. Case story. Meet John, age 72, living alone in his home. He felt a sudden weakness on his right side and slurred speech for a minute, then it eased. He ignored it. 2 hours later, the weakness returned full on, and he called for help. But the delay meant his recovery was much slower and he ended up with major disability. Safer alternative? If you're over 60 and feel any sudden change, weakness on one side, slurred speech, headache, confusion, treat it as a stroke until proven otherwise. Call emergency services immediately or ask a neighbor to help. Set up a plan with a trusted person ahead of time. Transition. Recognizing the signs is step 1. But just as important is making sure you're reachable, and that leads to tip 2. Tip 2. Stay connected. Don't let isolation delay help. Why it seems safe? Many seniors think, I'm fine alone, I can manage. They're used to living independently and feel confident. Hidden danger. If you have a stroke while you're alone, every minute of delay reduces your chance of a good outcome. For people over 85, death risk within a short time of stroke is over 7 times higher than for younger adults. The Copenhagen Stroke Study found that being 85 years or older predicted short-term mortality, OR 2.5, and long-term nursing home placement, OR 3.9, independent of stroke severity. David, age 68, lived alone in his flat. He suffered a mild stroke early morning, couldn't use his phone, and lay there unnoticed for 90 minutes before a passerby heard a faint sound and knocked on his door. The delay meant he missed the optimal treatment window. Safer alternative? Over 60? Make sure someone knows your routines. Wear a medical alert bracelet or keep your phone in reach. Let a trusted neighbor know your schedule. If you use medication or have risk factors, consider automatic check-in alarms or devices that alert someone when you don't respond. Connectedness matters, but preventing the stroke in the first place is even better. That's tip 3. Tip 3. Control your blood pressure and atrial fibrillation. Why it seems safe? Many seniors believe if they feel fine, they don't need to worry about blood pressure or irregular heartbeat. Hidden danger. High blood pressure and atrial fibrillation, AF, are 2 of the strongest risk factors for stroke in older adults. Ignoring them is like walking on thin ice. A systematic review found about 1/3 of strokes occurred in people over 80. Mary, age 75, always thought her slightly elevated blood pressure was just part of getting older. She skipped some doctor visits. Then she had a stroke while watching TV. Her recovery was hampered by the fact that the stroke was large and her blood pressure had been untreated for months. If you're over 60, get your blood pressure checked regularly, at least every 3 to 6 months. Ask your doctor about AF monitoring, especially if you have palpitations or dizziness. If you're diagnosed, take medication as prescribed and adopt lifestyle changes. Reduce salt. Stay active. You've got risk under control? Good. But when a stroke does happen, how you respond matters. That's tip 4.
Tip 4. Know where and how to get emergency care fast. Seniors often assume their local hospital is enough and that any delay won't matter. But here is the hidden danger. Some hospitals don't have specialized stroke units or rapid interventions. Time is brain. Studies show even in the very old, acute treatments like thrombolysis can be effective if used early. One large study found fatality at discharge was 24.2% for patients over age 80, compared with 13.4% for age 70 to 79, illustrating the increased risk with age. One of my patients, James, age 80, had signs of stroke and his daughter took him to a small local hospital. They lacked a stroke unit and he was transferred 2 hours later to a specialist center. The delay contributed to significant brain damage and he needed long-term care. Over 60? Locate the nearest hospital with a recognized stroke center before any emergency. Pin the address and phone number near your phone. If you suspect a stroke, call emergency services, not just drive yourself. Use FAST, face droop, arm weakness, speech difficulty, time to call. Time saved is outcome gained. Good emergency care is pivotal, but once you're out of the hospital, what you do at home matters. Let's go to tip 5. Prepare your home environment for safety after a stroke. Why it seems safe. Seniors often assume their home is safe because they've lived there for years. But here is the hidden danger. After a stroke, mobility may be impaired. Seniors living alone may fall, struggle to reach a phone, or be unable to call for help. According to research, older stroke survivors with multiple comorbidities do worse. Stat: in one study of patients over 75, 54% returned home, but 13% required long-term care. One of my patients from 2020, Ellen, age 67, had a mild stroke and went home. Her sofa height was too low and she struggled to get up after a brief lapse of consciousness. She was alone and fell, didn't have a phone nearby, and lay there for hours until a neighbor noticed she wasn't answering the door. Safer alternative. Over 60? Make your home stroke ready. Remove loose rugs. Keep phone or alert device within reach from the bed and sofa. Ensure lighting is adequate and have grab bars in the bathroom. Consider a medical alert button system. Discuss with a physiotherapist about mobility aids in advance. Home safety is one side. The next tip drills into ongoing health habits that shift your risk. On to tip 6. Stay active, eat smart, and manage cholesterol. Why it seems safe. Many seniors think exercise is for younger people and diet doesn't really matter at my age. The hidden danger is lifestyle still matters after 60. The body may change, but the risk factors for stroke, sedentary life, poor diet, and high cholesterol remain. The famous 7-country study found strong links between elevated blood pressure and stroke risk. Stat: older adults who have strokes often have worse outcomes when they also have multiple comorbidities or poor functional status. Case story: Peter, age 70, used to be active in his younger days, but in recent years he slowed down and adopted a rest more attitude. His diet drifted to convenience foods. He ended up with high cholesterol and then suffered a stroke that may have been avoided with better habits. If you're over 60, aim for at least 30 minutes of moderate activity on most days, walking, light strength training. Talk to your doctor or a physiotherapist about safe exercise. Adopt a heart-healthy diet, lots of vegetables, lean protein, less processed food. Monitor your cholesterol regularly and follow your doctor's advice about statins or other medications if needed. Active lifestyle lowers risk, but diseases still happen. That brings us to our final tip, to give you control even when worst comes. Tip 7. Have a clear post-stroke plan and support network. Why it seems safe, many seniors think if I have a stroke, the hospital will take care of it and I'll just recover at home. But here's the hidden danger. Recovery after a stroke, especially for seniors living alone, is tough. Without a plan and support network, you may struggle with rehabilitation, fall through the cracks, or face worse outcomes. The data show older stroke survivors with pre-stroke disability or living alone do worse. A recent study found overall survival after stroke was 79.4% at 3 months, 73% at 1 year, 52.8% at 5 years. Case story. Linda, age 74, had a stroke. She lived alone and no one had set up a recovery plan. She struggled to manage her medications, attend rehab, and fell once trying to reach the phone. Her recovery was slow and fraught with complications. Safer alternative. Over 60, create a stroke recovery plan before any event. Identify a family member or friend who will be your stroke buddy. List medications, emergency contacts, your doctor's info, rehab schedule. Ensure someone checks on you regularly. Discuss with your doctor what rehab would look like if you had a stroke. Having the plan in place before is far safer than scrambling afterwards. Those are the 7 tips. Let's wrap up. Recognize the warning signs immediately. Stay connected so help can reach you quickly. Control your blood pressure and heart rhythm, especially AF. Know where and how to get emergency stroke care fast. Prepare your home environment for safety if a stroke happens. Stay active, eat smart, manage cholesterol and general health. Have a post-stroke plan and support network ready.